Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today's topic is about canceling payer contracts. If you're opening your own practice and you're just getting started, chances are this isn't going to pertain to you. This is more for people who have been in practice a while or are maybe absorbing a new practice, like buying a practice or taking over a retired provider's practice, and they don't like some of the things that payers are doing, or maybe the payer isn't willing to renegotiate fee schedules, and you just want to be done with the insurance altogether. When you cancel a payer contract, it means that you will no longer be participating or considered in network with them. Patients who are insured by that specific payer will either have to be cash price, or if they're out of network benefits will cover the visit at your office, then they would have to utilize their out of network benefits. The unfortunate part about doing the out-of-network benefits is it's totally separate than seeing an in-network provider and using their in-network benefits, and it's kind of like two separate buckets. So if they're close to hitting their deductible with their network benefits and they see you after you're no longer taking their insurance and it goes to their out-of-network benefits, then they kind of have to start all over or fill that bucket separately. They don't combine. So patients will most likely not be happy about that, or maybe they won't understand it until they get the bill, and then they're going to be like, whoa, because out-of-network benefits generally don't cover as well as in-network benefits either. So even if they've met their deductible, instead of it being like 30% their responsibility and the insurance pays 70, it might be 50-50 or something like that. So their out-of-pocket costs overall will be more with out-of-network benefits. Not all payers and not all plans within payers have out-of-network benefits, and the only way you would know that is if you called or looked on the payer portal for that specific patient's benefits with their ID number to find out if they have out-of-network benefits or not. Or you can call the payer and ask, or you can ask the patient to find out if they do, which I really feel putting that on the patient is very reasonable, and helping educate what to ask and those types of questions only helps benefit their education level when it comes to their insurance and their benefits. So if you decide after weighing the pros and cons, if you want to stop seeing and participating with a certain payer and their patients, then you need to consult your contract that you have with that payer. The contract that you initially signed when you became participating and considered in network will have a section telling you how to cancel or withdraw from their coverage or their payer status. It will tell you if you need to put it in writing, who to send it to, how long in advance they need. So maybe it's a 90-day notice, so you would send it on the first of 1 month, and then assuming they accept it, it would be effective after 90 days. You definitely have to find out what's that time frame. Some might be 90, some might be 60 days, but there's definitely a specific time frame in which you have to give them, and you also have to usually do it in a certain way, whether it's an email and in writing or just in writing for a letter, but it will definitely tell you everything you need to do. My biggest suggestion in this letter is being specific on why you're not wanting to participate with them anymore. If you've tried to renegotiate the rates, or if you're not making any money but maybe losing money by seeing patients insured under their plans, and if you can include any kind of specific data, that definitely helps, because you will have it on record, and maybe if they have enough people doing the same thing, they will have to go back to the drawing board and figure out how they're going to salvage or renegotiate this issue internally so that future providers don't keep dropping them. I've never dealt with withdrawing service from a payer personally. I'm always usually on the side of trying to credential with insurances and negotiating fee schedules to increase reimbursement. I've never actually been part of withdrawing or stating we don't no longer want to participate with the plan. And I think that's less common than not, but with the way that insurances are lacking in their reimbursements, I think this might be an trending upward type situation that I wouldn't be surprised if it's going to become more common, because it costs a lot to run a practice and to see patients, and it seems that insurances aren't really caring about that when it comes to private practices. Of course, if you're part of a large entity, a big corporation, there's money coming in elsewhere a lot of times that will help make up that difference, but when you're a small private practice, it makes it really difficult. And having as much data as you can is really important. The government contracts, to my knowledge, isn't any more difficult to withdraw from than your commercial payers, and the MCO Medicaid plans, same thing. I think you just need to look at your contracts and it should tell you exactly what you need to do. If it doesn't, or you have questions, you should have a provider relations person assigned to you at the insurance company that you should be able to contact and ask those questions, whether it's through phone or email. Everyone has a provider relations department that you should be able to reach out to. A lot of times you probably already have something saved in your emails or your contacts because they were in communication with you while you were doing the contracting initially. But if you come into the practice late or you weren't involved in that process, then you probably just need to reach out to your provider relations and they will connect you with who would be assigned to your account essentially. If you don't have a copy of the contract, because let's face it, a lot of people are bad at keeping copies of that kind of stuff, then you can also call provider relations and ask for them to fax or mail you a copy of the executed contract. Be sure to say the executed contract, because the executed definition means that it was signed by someone in your practice and then it was also countersigned by someone at the insurance company. And once it's countersigned by someone at the insurance company, it's considered an executed contract and that's what is followed. If you're wanting to get out of your contract because you feel that they're not holding up their side of things or they're not being flexible, your contract will also usually tell you what process you need to go through to try to negotiate that or discuss that or bring it to their attention, and what could be done and what the steps are. The contract is really important to consult in any of these situations, whether you're trying to renegotiate your fee schedule and reimbursements, or you're trying to get out of the contract, or you are concerned that they're not holding up some agreement within that contract. It will tell you. So you definitely want to make sure that you have that at your fingertips. It's the first thing I do when I become a manager at a new practice. I ask the provider owner, whoever's, my boss maybe, if they have a copy of all of their current payer contracts, and ask to read them if I have some concerns or suspicions about a certain payer after looking at certain reports that I will run to see their financial health of the business. If you are going to withdraw your participation status with a payer, I would definitely have a letter that you send to patients in your database who are insured by that plan to notify them that as of a certain date that you will no longer be in network, and suggest that they find out if they have out-of-network benefits with their plan, and also let them know that if they don't, that you will offer a self-pay fee schedule, which your self-pay fee schedule should be the same for everybody, but let them know that is an option if they want to pay out of pocket, and just be as transparent and good at communication with patients from the get-go as soon as you can, so that they can make plans and do what they need to do in order to be able to either find a new provider or maybe save up cash or money to be able to see you the next time, whatever they need to do. But being very upfront with it and making sure that you are providing them with written communication, and then your staff is trained to have those conversations with patients when they call, is super important when it comes to customer service and retaining patients. If you have any questions or comments for this topic specifically, please leave that in the comments below. Also, if you have any questions, comments, suggestions for future videos, leave that in the comments as well. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you have not already. Thank you so much for the support. Take care of yourselves, and we'll talk to you soon. Bye-bye.